I like to divide rotator cuff repairs or reconstructions into 3 phases. The first phase, which lasts anywhere from 4 to 6 weeks, I call the healing or protective phase. The main goal of this phase is to maximize the patient's healing while protecting the repair. In phase 1, we like to minimize pain and maintain range of motion. Some of the techniques we employ are shoulder oscillations as well as passive range of motion. These are examples of Codman's exercises for shoulder flexion and extension, horizontal adduction and abduction, and then you could also use it for shoulder circumduction in both directions. The second phase I like to call the functional phase. This phase also lasts anywhere from 4 to 6 weeks. My main goal during this phase is to maximize the patient's function. I want to get that patient back to doing their activities of daily living, grooming, dressing. It may involve simple things like opening a door, closing a door, washing dishes with the use of their involved shoulder. This is an example of shoulder external rotation with a 3-pound resistance. The purpose of these exercises is to provide stability to the shoulder girdle, what we as physical therapists call the scapular muscles. I'm going to demonstrate some manual resistance exercises that I would assist the patient with in order to increase scapular strength and stability. This exercise helps to increase strength of the rhomboid and the middle trapezius muscles. And hold again, hold it, and slowly release. And now bring it back. And hold, 2, 3, 4, 5. This exercise helps to increase the strength of the lower trapezius muscle. And it can be done as a concentric strengthening exercise, which means the person will be utilizing that muscle and isolating the strength of that muscle. Or it can be used as an eccentric exercise where the person is holding the muscle and slowly releases it as the muscle lengthens. Then the third and final phase is the restorative phase from 6 to 8 weeks or beyond. And the main goal here is to just get that person back to their full function. I want to maximize the patient's capacity to return to whatever it is that they do, whether they be an athlete, an electrician, a carpenter, whatever it is that they may be. I want them to be able to work at their full capacity, carrying loads, lifting, using their arm, fully without any limitations. In phase 3, we like exercises that entail the use of the shoulder in different planes with a weighted ball. So the patient has to catch the ball and retrieve it while their shoulder is being challenged. In phase 3, we like to use a weighted ball, anywhere from 2 to 4 pounds, to increase strength of the rotator cuff. Some of the motions will include internal rotation and external rotation. Whatever it is that they want to do in life using that shoulder, I want it to be fully functional and as strong as possible.